I just made it to Austin, Texas. Just got off the road. Busy morning, busy weekend. I am here for a spine conference, another spine conference. I was just in South Carolina for some meetings, but here for a conference. It's called the Spine IEP. This is the second time I've been to this conference. This is a badge here. Basically, it's a fellows and young surgeons course. So they teach us things about what we should know coming out of our training. Last night, they had some lectures about practice building. What do you need to know about contracts and when you're looking for jobs, starting jobs. So there's some residents here that are like fourth-year residents, fifth-year residents that are going into spine surgery, and they give you lectures on these things. And then there was a dinner event last night that I went to. We just went over some patient cases. A surgeon kind of had some cases from his own practice, and we kind of talked about them in this big room. So it was. I feel really safe. They check your temperature when you came into the hotel. And then most of the lecture rooms are spread out. So at one table, there's only one person that can sit there. And even at dinner last night, there was a big table, one person on one side, other person on the other side of the table. So everybody's kind of spread out. So everyone's kind of following the safety measures. But yeah, I thought I'd come out here because, San Antonio is just an hour and a half away. And I went to go round at the hospital this morning. So I came out yesterday I had clinic all day long, and I left right after that to go see some patients in the hospital. And then I came out to this conference last night that started like 6 p.m. So got here a little late, and then late last night I drove back to San Antonio because I needed to go see some patients in the hospital this morning. And got up super early, like at 4:30 this morning. Went to go see a number of different patients in the hospital. And then I drove out here, just got here a few minutes ago. Drove out here to Austin, Texas. I missed some of the conference this morning, but they're having a little break right now, and I'm gonna go back and catch up with the rest of the people that's in the conference. And then the rest of the day is just lectures, talking about different things in spine surgery, cervical problems, lumbar conditions, and how we treat them as surgeons. And yeah, this course it's a really good course, and which I went to last year, and since it was so close, I was like, I'll just drive down and go to it and try to learn as much as I can. But it's basically to teach young surgeons, young fellows about spine surgery and different lectures, and this is how we learn. We go to a lot of different conferences. As you guys already know, if you follow my channel, you see I travel like everywhere. So I'll be here until tomorrow, and then I have to head back to San Antonio to see some patients in the hospital later in the afternoon. But yeah, Austin, Texas, here we go. Being a surgeon is hard, but who said it wouldn't be hard? You have to juggle a lot of things, you have to make a lot of sacrifices, and you have to go through a lot of challenges to get to the end goal. But once you are there, it definitely pays off. I've made a lot of sacrifices in my life. I've missed a lot of important family events. I've lost friends along the way, but I wouldn't trade it for anything in the world. I love what I do. I love the patients that I treat, and I love inspiring those who are coming behind me. So I just got done writing my patient's notes for today, and I had a few phone calls. So a couple patients called me and said that they were having some pain. So when a surgeon does an operation, the patients, they go home, they may have pain, they may have a fever, leg pain, arm pain, a cough, or anything that they have questions about. Someone needs to be on call to take care of these patients, and for this weekend, it's me. So basically, it's just phone calls from, the patient today had some pain, so I had to call in some pain medication to the patient's pharmacy. And I also had to call the pharmacist to make sure that they got it. But got my notes done, talked to a few patients, phone calls from nurses that were inquiring about a couple patients that are in the hospital. But I am running a little bit behind. They started the afternoon session at this conference. I'm about to go catch up with them and kind of get some of the lecture, learn some more about spine surgery. So we'll see you soon.
When you use the Delphi retractors, there's a line of ischemic tissue, but that usually gets better than comparison encourage my patients post-operatively to lie on their side and not lie on their wound. I don't know if that makes a difference. I don't think we can ever prove it, but that's what I did. Really aggressive blood glucose control is important, as most people know.
All right, guys, I just woke up. It's about 7 a.m. I'm about to head down to the last part of the conference. Today it's just lectures on things that we should know when we go out into practice or your first year of practice. Most of the people here at this conference are, like I said, either chief residents or they're fellows, or they like myself, they're in their first year of practice. And it's just a few lectures today, and I have to head back to San Antonio to see some patients in the hospital. So another thing that, as a surgeon, I don't do a lot of reading, like sitting reading a whole textbook like I did as a med student or a college student. So the big difference as an attending is that I do most of my learning in conferences like this. So I'll travel to a conference and learn about the new techniques, technologies, review certain things. So we had lectures on cervical radiculopathy yesterday, which means a patient has a herniation or a bone spur in their neck that's causing radicular pain, like shooting pain down their arm. So you constantly have to review the information, and I've probably reviewed cervical radiculopathy like 100 times, and I will probably review it 100 times more over my career, or 1,000 times more. So that's the biggest difference. I read a lot of articles, journal articles. If I'm looking at a certain condition, like I have an upcoming surgery for proximal junctional kyphosis. This is just a patient who has surgery, like a lung fusion, and they tip over, they collapse at the top of their construct. Well, I have that big surgery coming up this week, and I read articles about that condition to see how it's best treated. I have an idea in terms of my experiences and my training, but I want to see kind of what else is out there. What does the literature kind of show? That's what all entails what's called pre-operative planning. And for the med students on this video, or the residents, surgical residents especially, you need to plan for your surgeries. Like going into a surgery without planning for it and thinking about every single step is a disaster, is a setup for a disaster. So a lot of things can go wrong in surgery, and you have to think them out, you have to plan for these things. Otherwise, you're gonna go into the operating room and be lost. So every single surgery that I do, there's a lot of planning that is involved in it. So I'm not, as an attending, I'm not reading textbooks or sitting there studying for 8 hours or 12 hours or 18 hours like I did as a med student. I plan over sometimes multiple weeks. This surgery is like this coming week, and I've been planning for this for the last week or so. So I'm talking to my mentors. Hey, what would you do with this surgery? What would you do with this case? I'm reading anatomy books to review my anatomy, and I have a pre-operative plan. So surgery residents, even if you're going into medicine, you will be doing procedures like a paracentesis or a chest tube. You need to have a plan for that. So my surgery plan is just on this PowerPoint, and I list every single kind of step out that I plan to do and everything that I need for that surgery. So when I'm going into the operating room, I'm trying to not tell my nurse, hey, I need this, I need this, I need this, I need this every 5 minutes. You want to be efficient in terms of your surgeries and the flow of surgery. So I think about everything that I will need, from the sutures, from the type of graft. I will need a drill. I plan to use intraoperative navigation, so I'll need that big O-arm to do a spin. So the surgery team and everyone else is on the same board in terms of my plan of surgery. And I talk about the steps of the surgery. I'm gonna make my incision here. I'm going to remove a rod and then add a longer rod and do my fusion, do my decompression of the nerve, and that's my preoperative plan. And at each individual level of the spine, I measure the pedicle. I measure how big the pedicle is, how long the pedicle is, the length of it. So I already know kind of going in what size screws that I will need for this particular case. So I do this for all my cases, and that's something that I would suggest if you're a junior resident, medical student who will soon be a resident, you need to know about these things. So that's kind of how my kind of education is at this point. Like I said, I don't do a lot of reading textbooks. I review and just read articles. I listen to lectures, like pre-recorded lectures. So say for instance, I'm driving 20 minutes from one hospital to another. There's lectures that are 15 minutes. So I will listen to that lecture during that drive, and that's my education for the day. So every day I try to learn something new, constantly trying to improve, constantly trying to strive for excellence. And this is something I would suggest everyone do as well. So that's kind of the biggest difference between being a med student, being a resident, and being a staff physician, or even a fellow, is that I don't have time to sit there and read textbooks. I just review certain things that I have already learned and kind of reinforce certain topics. And I plan a lot, even sometimes weeks out. I'm sitting there, like last night, I was thinking about this case. What should I do? Or should I add these types of screws? What type of rod? Would I use cobalt chrome versus titanium versus stainless steel? So what type of graft will I use? You have to think about all these things. And that's kind of the hard part, which is also pretty fun about being a surgeon. You can come up with your own way of practicing. That's why it's called practice medicine, because it's your kind of using your skill set, your training, your knowledge, your experiences to provide the best care for the patient. So that's the fun part. But hope you guys learned something in this video. Hope you guys picked up a few tips, and about to go down and finish the rest of this conference here and head back to San Antonio to head back to the hospital. So we'll see you next time.